With today's workshop, we are going to work on improving our skills in shared decision making between patients and providers. So as we've talked about several times in class, shared decision making is defined as an approach where providers and patients share the best available evidence when faced with the task of making decisions, and where patients are supported to consider options to achieve informed preferences. So this idea of shared decision making draws and deepens the principle of patient-centered care. And patient-centered care, it takes into account the important physical and psychosocial aspects of illness, including cultural beliefs, attitudes, norms, and coping abilities, as well as life events that may interact with and or complement physical health problems. So I was able to find a case study, and I was also able to find a three-step model to help accomplish this task of improving improving shared decision making between providers and their patients. So the case study involves a lady named Catherine. She was 67 years old, and she had recently been diagnosed with breast cancer. She was offered a choice between a lumpectomy with radiotherapy or a mastectomy. And she was told that there was an equal survival rate for the two procedures. She was surprised by her choices, and she was very anxious. She had listened to the advice of the provider, and she was given very good information. And she felt steered towards having a lumpectomy and radiotherapy as the less invasive option. After experiencing the symptoms of the radiotherapy, she felt regret and considered that her decision might have been different if she had been given more information and a chance to express her strong wish to avoid recurrence. So, there are three key steps in the SDM, or the shared decision making process, and the first being choice talk. Choice talk is about making sure the patient knows that there are reasonable options out there and that they do exist. The step doesn't necessarily have to be done face-to-face. It can be done over the phone. It can be done by email, by letter. And there are several components of choice talk, which include step back, and this is for the physician to summarize what they have said to the patient. There's offer choice to make sure that the patient knows that there are choices out there for them. Justify the choice, and emphasize the importance of respecting the individual's preferences. Check the reaction of the patient, and then defer closure. The second step in the SDM is option talk. And option talk is it refers to providing more detailed information about options. So once again, you're going to check the knowledge of the patient, just make sure they are aware of options, list the options, and then describe the options. Describe harms and benefits of the options, and then provide the patient with a decision support. So these can be things such as like decision boards, or just any tool that can help the patient to understand more about the decision they have made. And then the last step is to summarize, and just once again, like assess the understanding of the patient, make sure everything is very clear to them. And then the third step is decision talk. And decision talk is referring to supporting the work of considering preferences and deciding what is best. So the first step in this last step is to focus on preferences and to guide the patient to form their own preferences. And then the second is to elicit a preference and just be ready with a backup plan by offering more time or being willing to guide the patient if they indicate that that's their wish. Next is moving to a decision, and it's important to try and check for the need to either defer a decision or to make a decision. So some patients might need more time, or some might be ready to make the decision right there on the spot. And then the last thing is to offer review. And it's important to remind the patient, where feasible, that decisions may be reviewed, that decisions may be reviewed, and is a good way to arrive at, this is a good way for them to arrive at closure. So this is a model of how to do the SDM in the clinical practice, and the best way to learn these skills would be to use simulations either with colleagues or with trained actors. Thank you.